Obesity is a health condition where a person carries excess body fat. Over 2 billion adults are overweight or obese. Significantly affect mental and social well-being. Obesity is a health condition where a person carries excess body fat. This isn't just about looking a certain way. Too much body fat can seriously harm your health. It increases the risk of many diseases impacting how your body functions and your overall well-being. Understanding obesity is crucial because it's becoming increasingly common worldwide. It's a complex issue with no easy answers, but addressing it is vital for individuals and societies. We need to understand what obesity is, its causes, and how we can manage and prevent it for a healthier future. Doctors use a tool called Body Mass Index, or BMI, to determine if someone has obesity. BMI is a calculation based on a person's weight and height. It provides a measure of body fat, although it doesn't directly measure body fat percentage. A BMI of 25 to 29.9 is considered overweight. A BMI of 30 or higher is classified as obese. While BMI is a helpful screening tool, it's not perfect. It doesn't account for factors like muscle mass or body composition. For example, a very muscular athlete might have a high BMI but not be unhealthy. Obesity rates have been rising dramatically around the world over the past few decades. This trend is concerning because it puts a strain on healthcare systems and leads to a rise in chronic diseases. According to the World Health Organization, over 2 billion adults are overweight or obese. Obesity affects people of all ages, genders, and socioeconomic backgrounds. However, certain groups, like those with lower incomes or living in areas with limited access to healthy food, are disproportionately affected. Obesity is about more than just excess weight. It's a complex condition that affects many systems within the body. It significantly increases the risk of developing several serious health problems, including heart disease, where excess weight strains the heart, increasing the risk of heart disease, heart attacks, and strokes. Type 2 diabetes, as obesity disrupts how the body uses insulin, a hormone that regulates blood sugar, leading to type 2 diabetes. Joint problems, since extra weight puts pressure on joints leading to osteoarthritis, a painful condition affecting the knees, hips, and back. And breathing problems, as obesity can cause breathing difficulties, including sleep apnea, a condition where breathing repeatedly stops and starts during sleep. This is not an exhaustive list. Obesity is linked to an increased risk of certain cancers, fatty liver disease, kidney disease, and other health problems. Understanding these risks is crucial for recognizing the seriousness of obesity and the importance of taking preventive measures. Obesity's impact extends far beyond physical health. It can, significantly affect mental and social well-being, leading to a diminished quality of life. Living with obesity can be stressful, often resulting in anxiety and depression. People with obesity often face weight bias and discrimination, which can affect their self-esteem, job opportunities, and social interactions. Feelings of shame or self-consciousness can lead to social isolation, further impacting mental health. Addressing the mental and social aspects of obesity is just as important as managing the physical aspects. Support groups, therapy, and fostering a more accepting and inclusive society can really play a significant role in improving the well-being of individuals affected by obesity. Obesity is a complex issue with no single cause. It results from a complex interplay of genetic, environmental, and behavioral factors. For instance, consuming a diet high in processed foods, sugary drinks, and unhealthy fats contributes significantly to weight gain. Also, a sedentary lifestyle with limited physical activity makes it easier to gain weight and harder to lose it. Sleep deprivation is another factor. Lack of sleep disrupts hormones that regulate appetite, increasing cravings for unhealthy foods. And genetics play a role in how our bodies store fat and regulate metabolism, making some individuals more susceptible to weight gain. In addition to these factors, environmental influences like city living with limited access to green spaces for exercise and pervasive marketing of unhealthy food choices contribute to the problem. Understanding these multiple contributors is essential for developing effective strategies to combat obesity. Obesity is a major risk factor for several serious and potentially life-threatening health complications. The longer a person lives with obesity, the higher the risk of developing these conditions. Obesity increases the risk of various cancers, including breast, colon, and endometrial cancer. Excess weight can lead to fatty liver disease, a condition where fat builds up in the liver, potentially leading to liver damage or failure. Obesity also increases the risk of stroke, a medical emergency that occurs when blood flow to the brain is interrupted, and it can disrupt hormones, leading to fertility problems in both men and women. These complications highlight the far-reaching impact of obesity on long-term health and well-being. Early intervention and management are crucial for reducing the risk of developing these serious health issues. Managing and preventing obesity requires a multifaceted approach that addresses both individual behaviors and societal factors. There's no one-size-fits-all solution. Strategies must be tailored to individual needs and circumstances. Adopting a balanced diet rich in fruits, vegetables, lean protein, and whole grains is crucial. Engaging in at least 150 minutes of moderate-intensity exercise or 75 minutes of vigorous intensity exercise per week is recommended. Therapy can help address emotional and behavioral factors contributing to unhealthy eating habits. In some cases, medications can help manage weight by suppressing appetite or reducing fat absorption, and for some individuals with severe obesity, weight loss surgery might be an option. Regular checkups with a healthcare provider are essential for monitoring health and receiving personalized guidance on managing weight and preventing related health problems. Tackling the obesity epidemic requires a collaborative effort from individuals, healthcare providers, policymakers, and communities. It's not just about individual responsibility. Creating a supportive environment is crucial. Individuals can make healthier choices regarding diet and exercise. Healthcare providers can offer personalized guidance and support. Policymakers can implement initiatives promoting healthy lifestyles, such as encouraging healthier food options and making communities more walkable and bike-friendly. Early action is vital. Addressing obesity in childhood is particularly important, as habits formed early in life often continue into adulthood. By working together and prioritizing prevention, we can strive to create a healthier future for all.
This is why you need to know about obesity, and it's more than just extra pounds. Obesity isn't just about looks. It can seriously mess with your health. First, it puts a lot of strain on your heart, making it work harder. This can lead to high blood pressure and heart disease. Not cool, right? Next, carrying extra weight increases your risk of type 2 diabetes. This means your body struggles to manage sugars, which can lead to serious complication. And let's not forget about your joint. Extra pounds put a lot of pressure on them, leading to pain and arthritis. So, what can you do? Start with small steps. Eat healthier, move more, and talk to your doctor. Remember, your health matters. Like, comment, and subscribe for more tips on living your best life. Thanks for watching.